within 1 year we'll be seeing 100,000 deaths from a new infections. I would probably not have believed that, but here we are in that scenario. With respect to the variants, and with a focus to the 2 new variants, and going forward, I would not use the word, I would not associate a country to a variant, because we at Africa CDC have taken an exception of characterizing a variant like to belonging to a country or country of origin, because again, we as the global health community have also agreed that it wasn't appropriate to be linking the COVID-19 virus country. So again, I will use the word the 501YV1 variant and characterize it that way, and then the 501YV2 variant to distinguish the two. So I think the most important thing is the V1, V2 variant. The V1 variant has been so far reported in the Democratic Republic of Congo, Gabon, Gambia, Ghana, Morocco, Nigeria, and Senegal, and South Africa. The V2 variant, that is the 501YV2 variant, has been reported in 11 countries in Africa, and that is Botswana, Comoros, DR Congo, Gambia, Ghana, Kenya, Malawi, Mozambique, South Africa, Zambia. So in terms of the number of countries that are reporting close to 70% of the total caseloads, they include the top 5 in Africa, South Africa representing about 40% of all the infections on the continent, Morocco 13% of all the cases on the continent, Tunisia 6%, Egypt 5%, and Nigeria 4%. The case fatality ratio, again, our case fatality ratio continues to be above the global average of 2.2%, and 21 countries, that is 38%, are reporting case fatality ratios that are more than 2.2%. I will not read all of them. So let's go look at the trends. So last week when we met here and we compare what we have observed with what observed over the last 1 week, what are we seeing? Between February 8 and 14, we have recorded 99,710 new cases. And this represents a 25% decrease of new cases over the last 1 week. That is our epidemiologic week number 5. We've also seen the similar trends for deaths, where over this last week, we observed that a total of 4,102 new deaths were recorded across the continent. And that also represents 28% decrease compared to the previous week, week 5. So I think overall, from last week to this week, we are seeing some encouraging trends, and we are really pleased with that. And we continue to urge countries to do what they are doing, because Spain is yielding the right outcomes. The highest proportion of new cases reported for the last week came from Southern Africa, representing 41%, West Africa 21%, Africa 5%. 5 African countries that are reporting the highest number of new cases of South Africa, Zambia, Nigeria, Tunisia, and Mozambique. So if we now look at the trends over the last 4 weeks, and which will give us an overall better trend tendency, we see that between January 18 and February 14, we have recorded an overall average decrease of 21% in new cases across the continent. And if we now look at the continent by region, we observe a 29% decrease in Southern Africa, 18% decrease in Northern Africa, 3% decrease in Western Africa, 1% decrease in East Africa, and 1% increase in Central Africa. That is the trends over the last 4 weeks. If we now look at the 5 most populous countries, over the last 4 weeks, we see some differences across as following. Egypt, average 10% decrease. Nigeria, 13% average decrease. DRC, 17% average decrease. South Africa, 38% average decrease. Kenya, a slight ticking up over 5%, and Ethiopia about 16%. So that is the epidemiological trend so far. Let's now look at the testing. Overall, as a continent, all 55 member states have now conducted a cumulative number of 34.6 million COVID tests, and with an overall positivity rate of 10.9%. For the 2 member states have a test positivity rate of above 5%, which is still a lot of cases going out there. As we announced last time, we as the Africa CDC are really actively working to roll out the antigen tests, which member states are uptaking, and we are also continuing to roll them out and support member states to increase that level of testing, because we believe that is rapid, is more is scalable, and is easy to use, and it gives you very accurate results. In terms of the sequencing, in light of these emerging variants, we continue to support countries to generate sequences across all member states. And as of today, 7,000 COVID sequences or SARS-CoV-2 sequences have been uploaded on the international portal to monitor the circulation of a new variant. On this, let me just add that our target is to, as Africa CDC, is to expand this to about 50,000 genomic sequences in the coming months. And hopefully towards the 4th quarter, we should be able to achieve this target. Again, it's a goal we are setting, an ambitious goal we are setting for ourselves, but we have to do that in order to better understand what is going on across the continent. For the epidemiological week 6, that is between 8 and 14 February, 915,000 new tests were reported, and this represents a 14% increase in compared to the previous week that we observed 800,000 tests conducted. So that is in terms of the testing. Let's just go over a few other capacity building activities that Africa CDC is doing. We are continue to conduct clinical management to support member states through webinars to 42 clinicians across member states. Infection control prevention courses are continuing. We continue to enhance member states with those in those areas there, and also developing advisory protection notes on respiratory protection equipment. Now, on vaccines, to conclude the COVID section, as we announced previously that through a partnership with MTN Mobile Telecom, they generously donated $25 million to support vaccination of healthcare workers. And I'm pleased to announce that the delivery of the first 1 million doses across the continent will start from next week. We are hoping that before next Friday, that delivery will start going out to member states. And that will be the first attempt to try to reach out to about 20 countries with vaccines. And then at least that will enable us to start vaccinating our healthcare workers and also learn from the process by doing it. So we are very excited with that prospect. The Africa CDC is also putting up as quickly as possible a COVID-19 dashboard for monitoring vaccine rollout, which will go live hopefully soon, so that each time you can go on that dashboard to at least acquaint yourself with what is going on. With respect to the overall AVAT, which is the African Vaccine Acquisition Task Team efforts, last week, a colleague wanted to know how many countries have submitted the applications and what doses there. So we promised to come back to you this week, and we are here to say that 26 countries have submitted their applications, and resulting to an overall number of doses tallying to 180 million doses there. So again, remember the process will work as follows. I mean, countries will submit all their requests. The deadline was 15, and those will be picked up by the Afri-Exim Bank, and then the arrangement will start from there. And once they finalize the financing arrangement.
All right, there you go. An Africa CDC briefing there with regards to the latest numbers of COVID-19 in Africa. Look, it actually puts into context what we're going through here as on the continent. A year later, almost a year later, these are the numbers here on the continent. To date, over 3.7 million cases, cumulative